Hi, Sojourns community. This is Dr. Jessica Perkey. I'm a naturopathic physician at Sojourns. I just wanted to pop on and express gratitude for all of you who have engaged with our recent email regarding group medical visits. Thank you so much for completing the survey in our last email. It's helping us better understand what questions you have and what topics you may be interested in us leading groups on. So here at Sojourns, we're all really excited to be developing a program that works towards increasing community connection. And we're doing that by adding these group medical visits to our offerings. Group medical visits are also known as shared medical appointments. And it is a new type of healthcare model where multiple patients with similar health concerns or conditions will be seen together by a healthcare provider instead of a traditional one-on-one format of a doctor-patient visit. Group medical visits typically involve a healthcare provider leading a session with a small group of patients, typically 6 to 15 patients, although group sizes can vary depending on the provider and the nature of the visit. Group medical visits are often longer than one-on-one doctor-patient visits. They can be anywhere from 60 to 90 minutes, and the extended time allows for more comprehensive discussion and education. During the meetings, there may be individual assessments, discussions, group education, patients sharing their experiences. And these sessions will meet monthly, but they may transition to more frequent or less frequent meetings depending on the needs of the patient and your interests. There will be multiple patients seen together by a healthcare provider, and so understandably that can raise some concerns about privacy. There are several measures that will be implemented to protect your privacy in these settings. So if you'd like to participate, every participant is required to sign a confidentiality agreement, which will basically they're agreeing to not disclose any personal information about other patients shared during the group visit. Also, everybody who is participating will sign a consent form. Other things that will be implemented is basically first name basis oftentimes, and then we typically don't go into detailed medical history on as individuals during these visits either. If there ever is something that feels confidential that comes up during a group medical visit, you will have the opportunity to be in touch with the provider there so that some confidential things can be shared outside of the group if needed. Another question that came up is about insurance and the costs of group medical visits. And typically group medical visits are eligible to be paid for by insurance as a medical visit. It may be the same as if you were to come in for an individual appointment. As many of the group visits will be led by naturopathic physicians, if you are already seeing an ND or a naturopathic physician at Sojourns, your coverage will be the same as your one-on-one format or usual visit. Many insurances cover NDs, however, there are some that don't, so Medicare and Medicare Advantage programs do not, and some out-of-state insurances do not. You can always contact your insurance company to be certain. Just as with any other medical visit, you may have a deductible amount or you may have a copay amount for each visit. And so if you're not already aware of the terms of your individual policy, you may contact your insurance as well to discuss it. But basically, the group medical visits will be covered in a similar way as a one-on-one visit. And if your insurance accepts ND coverage, there's a good chance your insurance will accept a group medical visit. Okay, I hope that was helpful and that answered some of your questions. And please stay tuned for more information about the benefits of group medical visits and what classes and offerings will be coming out on our schedule soon. Okay, have a beautiful day and thank you for your attention. Take care.